having a second round, but having said that, I'd like to ask a couple of questions myself, unless there's concern about being left out, anybody else. I just want to capitalize on just a couple of things. First of all, community care, is there ALS and these circumstances in which it makes sense in your minds to refer to a program, a hospital, a set of physicians that have expertise in this arena, and it makes sense for the VA to allow for referral to that community care? Ms. Ward?
Yes, I'd like to speak to that. We have an excellent ALS center at the Duke Center for ALS Care Clinic, a clinic experience for somebody with ALS. They fortunately do have clinic rooms that they are large enough to support not just somebody who's in a wheelchair, but family members to come along with them. And they stay in that room for hours. Every specialty comes to see them. Respiratory care, pulmonary, social workers come through, the ALS Association will come through, your neurologist comes through. It's an exhausting experience. It's a great experience, though, because you get soup to nuts there. But to try to get a community care referral, you have to get one for each specialty that's there, right? So that's hard work to get a community care, especially for it all to come together so that you have a referral for every specialty care healthcare provider that comes to that room. For us personally, we use Medicare because it's easier. I mean, is it the right thing to do? Probably not. Probably really should go through the VA to make that happen. But it's hard to do, though, too. So, I personally don't want to go through all of that.
I appreciate knowing that, and it seems to me that that's not a damning thing about referral to community care. It's a damning thing about the way we refer it to community care.
Yeah,
if we could get the referral fixed, that'd be an improvement, and you'd have in this instance, a level of expertise, a combination of all the services in one location that might make sense for a particular veteran or a veteran's family member. Mm-hmm. Because the standard in community care is what's in the best interest of the veteran, to be determined by the veteran and his or her provider. And in some instances, there may be a program, as I say, a facility, a set of doctors, a continuum of care that might make sense. And I want to make sure that if that's the case, best interest, that's a possibility. Mr. Thomas, let me conclude my questions with just a follow-up to something that's been said in response to my colleagues' questions. The issue of the Access Act, one of the things that occurred, and the PVA supports the Access Act, but one of the reasons that's true is because we addressed the concerns regarding the VA's referrals to community providers who are ill-equipped. We heard testimony today about we heard testimony about this being a new thing to a neurologist, not treating an ALS patient. And the PVA advocated for provisions in the Access Act to address this issue of referrals to people who are ill-equipped to handle the referral. Is that true? And you have anything to say about that?
So I would say that is true, and it is hard to get when you get a referral and go out there into the community, as was stated, that individuals need to be able to choose who they want to choose, and we understand that, and we are on board and agree with that, but we need to be referred to doctors that truly understand the aspect of what SCID entails on the body. And a lot of times when we're referred out there to the community, they don't understand that. So that's why most of our members choose the VA.
That makes sense to me, but I do want to highlight, at least my understanding, the Access Act includes language that veteran organizations, and I think including the PVA, encouraged to be included in the Access Act that deals with the concerns about referrals to someone who shouldn't be referred to because it's a new experience for them, that's new field for them, same field, I guess, a different kind of patient and a different kind of circumstance. And we want to make sure that the referral is actually to a provider that provides the expertise and experience that actually helpful to the veteran. So we'll continue to work on that, but I think that is part of our efforts in this Access Act to improve that circumstance. I thank you all very much. Senator King summed it up very well. Thank you for being such advocates. Thank you. I recognize that in instances here, it's very difficult for you to be away, difficult to be here, and we're grateful that you take the time. It demonstrates that you care about your loved ones, you care about people you don't even know because you want the system to work, want the VA to work, and the process to care for those who served our country, and we're all grateful for that. And I thank you for your presence. We're going to call